Hello, East Africa. Good morning and welcome to your world, which is changing by the day as a result of the COVID-19 pandemic. Now, you used to have a set routine of when to get up, when to travel, when to get to work, when to leave, how to get to school, what to learn. Not anymore. The new coronavirus has flipped our world and has turned our homes into a gym, church, mosque, office, school, and playground. We started this new show last week to keep you company as you adjust to the new normal. Each weekday morning, we pick a topic and share views and experiences of life in the East African region and the world at large with help of experts here in the studio and on Skype. Today, we focus on hygiene and assess how our social, cultural, and religious practices and beliefs could help or hinder the fight against COVID-19. Your views, comments and questions and your home videos are very welcome. You can reach us by phone or WhatsApp or simply our hashtag #NewNormal. Anna, quickly a look at the situation regarding the COVID-19 pandemic around the world, starting with the global picture. As at this moment, we have 2,407,340 people who've been confirmed positive for COVID-19. And out of these, 625,128 have recovered, and we've got, unfortunately, 165,069 people who've died around the world. And if I may just pick a few of the countries showing huge numbers, America, 764,265 people confirmed positive. We've got 71,012 who've recovered, and 40,565 people have died. In Spain, it's 198,674 who've tested positive, 77,357 people have recovered, and 20,453 deaths. Italy, which was in the news for quite a few days, 178,972 people confirmed positive, with 47,055 people who have been confirmed as recovered, and 23,660 deaths. Okay, that's the situation around the world. And now, I also want to give you a very quick update on what's happening in Kenya itself. Yes, this is where we're at. Kenya, we've tested 13,239 people. 270 have been confirmed positive. We've had sadly 14 people who've died so far and 67 people who have recovered. That's the situation around the world and here at home in Kenya. Now, 7 bodies found at a nursing home hit by virus in New Jersey. Police discovered 17 bodies inside a nursing home's morgue on Monday. Deaths believed to be related to the COVID-19 outbreak. The Andover Subacute and Rehabilitation Center is only equipped to handle 4 bodies.
Just a quick question. I live around the corner. What's going on?
Now, some details have emerged over an alleged fake funeral by a family headed to Homa Bay that could discredit what the government had said yesterday. The health minister claimed that a family, in the guise of mourners, managed to travel from Nairobi all the way to Homa Bay, only to be stopped at a roadblock and found with an empty coffin. Surveillance has since been intensified along all Homa Bay County entry points, screening and sanitizing people, as NTV's Bernardo Ojwang explains. And as we wait for that report, again, let me give you a little snapshot on the East African situation. Around East Africa, these are the figures that we're dealing with as at this morning. In Tanzania, we've got 171 people who've been confirmed positive. We have had 5 people who've died so far, and 11 people have recovered. Ethiopia, the cases stand at 105 positive, 3 people who've died, 16 people who've recovered. While in Somalia, we've got 135 people who have so far been confirmed positive. 7 people in Somalia have died, 2 have recovered. In South Sudan, The number of cases confirmed is 4, and so far no reports yet of any death or any recoveries, but I'm sure they're still continuing to test the population. Uganda, the cases stand at 55 people confirmed positive. No one so far has been confirmed dead, and 20 people have recovered. In Rwanda, 144 people confirmed positive. No one so far reported dead, and 69 people have recovered. While the situation in our other East African country of Burundi, 5 people confirmed positive, 1 person has died, and no one so far has been reported to have recovered. So that's what's happening around East Africa. Now, that's the situation at the moment. I'll be joined very shortly by our guests here in the studio. I'll start first of all with Dr. Dennis Nturibi, who is a medical doctor and managing director of Ask a Doctor Limited and a co-founder, I believe, a healthcare provider focused on personal and corporate health. Welcome.
Thank you.
Okay, and we'll also shortly be joined on Skype by other experts this morning. We've got Sheikh Abdulatif Sheikh from the Family Resource Center at Jamia Mosque here in Nairobi. We also will be joined by Pastor Muredi Wanjao, who is a senior pastor at Mavuno Church. John Wilson Joroge, who is a youth mentor, co-founder of Lead Global Impact, will also be with us. And Dr. Ken Ouko, a sociologist and lecturer at the University of Nairobi. Now, to you, first of all, Dr. Nturibi. Now, we're talking this morning about hygiene is our main focus of discussion.
Yes.
How do we go about minimizing the risk of catching or even spreading the new coronavirus? What are your thoughts on this?
So as the government has been saying from the beginning, this virus is transmitted when we come into contact with it, either through contaminated surfaces. So maybe I have the virus, I cough, do the typical thing of put my fist to my mouth, and then as we go about, I touch the phone, the sofa, the table, and then you, my colleague, come and touch the same thing because it's part of work and maybe you're answering the same phone. You pick the virus and then you touch your face, your mouth, your nose, your eyes, and maybe the virus gets in through what we call the mucous membranes, which is the lining of your mouth, your nose, or your eyes. Now, once that virus makes contact with that, then it starts entering your body and is expected to cause the infection. So the whole concept of hygiene is to minimize, first of all, if I am sick, that I don't transmit the infection to the environment. Because if, for example, I cough into my hands, but then as I pass by, I sanitize those hands, the sanitary agent will kill the virus, which means when I touch the surface, the virus will not be in existence. Same thing if I wash my hands with soap and water, which is pretty straightforward and a simple agent that kills the virus. Now, if you do the same, it further reduces the chances of that virus causing, infecting you. Because if, for example, you touch surfaces and there was a virus, but then you wash your hands or sanitize on a regular basis, it reduces the chances that you'll contaminate yourself.
So at the very basic level, that is what we ought to do at just at the
Yes,
very primary stage of.
and that is actually what is most effective. So when we are talking about managing the hazard, it's important that we understand there are what we call the hierarchies of control. First of all, we need to eliminate the hazard. So for example, if I am sick and I never leave my house, how can I infect you? Okay, so eliminating the possibility of you coming into contact with the virus is the first level, even before we use any gloves or masks. Then the second level is maybe we can ask ourselves, how can we achieve the same outcomes in a different way? We call that substitution. So for example, some guests are joining us on Skype today. Actually, 3 guests are joining us on Skype today. Traditionally, those guys would have been here, okay? But we want to maintain social distancing, so not everyone comes here today. So we achieve the same effort, we achieve the same outcome rather, that we have a show, we have guests, but they are not here physically.
And there's at least a good 2 meters plus between
and then there's
you and
space
I.
between us here in the studio. The third thing is engineering controls. But for the sake of the common person, this might not really apply. In the hospitals, they talk of the ideal environment to manage a virus like COVID-19 is a negative pressure room, negative pressure ICU room. So that would not apply out here. And then the fourth level is administrative controls. And this is like Q&I, social distancing. Then finally, PPE. So PPE is the last level, and it manages residual risk. Now, commonly we have a misunderstanding that we think what I need is PPE. But remember, there are all those 4 levels before.
So by PPE, you mean things like
personal protective equipment,
yes. Right.
gloves, masks, and all that.
But we seem to have started there. You
Yes,
said
and that's lack of understanding.
Right.
And that's what we're hoping to help people understand, that all these measures the government has sort of put in place, it has been done because we know they're the most effective. By the time we come to PPE, we should have significantly managed the risk with all the other 4 levels.
So let's talk about the mask, which is one of the common tools that's being advised. What's the importance or relevance of wearing a mask?
Maybe let me start by looking at the end, okay? So for a medical person who is managing a COVID patient, the patient is confirmed to be positive. So we know, for example, when that patient coughs or sneezes, or their saliva comes into contact with a surface, they have released the virus, okay? So if they cough or sneeze and I am a doctor taking care of them, if I have a mask and the right kind of mask which filters out most viral pathogens, it means that then I do not inhale the mask. But remember, that patient is being managed in a negative pressure ICU room. So the minute they cough or sneeze, the air is continually being sucked out. So even before I'm protected by the mask I'm wearing, there are other measures in place, okay? Then we now come down to the mwananchi out here. I think for now, we are concerned about community transmission, which basically means that the virus is now with us in the community.
Which is where we're at?
Yes, as the government announced, I think yesterday, some of the latest cases were not picked from quarantine centers, okay? Now, when we're using masks in the community, we are doing 2 things. If I am sick and I'm wearing a mask, when I talk, when I cough, when I sneeze, those particles are contained within the mask I'm wearing, which finally reduces what I emit into the environment. And then we are keeping a social distance so that even if I do emit something into the environment, further we reduce further the chance of it reaching you. If you've also observed other things like adequate ventilation, a lot of companies have reduced the number of people in their office so that the ventilation that is in place is not being shared by 10 people, maybe by 2 or 3. Then you open windows, ensure free movement of air. Okay?
So congested spaces are
not
difficult.
ideal. And that's why you saw even with public transport, they reduced the number of people in a public transport vehicle. And then finally, now you are wearing the mask. So in case there is still particles in the air, then you have a mask which again reduces the amount of particles that get into you.
Let's talk about masks. We've seen all types. We've seen surgical, we've seen high-end, we've seen kitenge, and sadly we've also seen people who are wearing padded bras.
Very unfortunate.
Take us through about the right type of mask and what's the best one to have really on your face.
I think I would say in an ideal world, we would all be using surgical masks, okay? But remember, there's also an issue of cost and resources. Many countries, even countries that are much wealthier than us, are also struggling with this issue, okay? And this is what has led to the introduction of the cloth mask, which, yes, will reduce the amount of particle emission into the air, but not by a large percentage. So the masks then are used or recommended based on the risk profile. So a medical person taking care of a COVID-19 patient needs to use what is called an N95 mask. It's called 95 because it filters 95% of particulate matter. But for you and I out here in the community, a surgical mask is adequate, and I think we are grateful and thankful that finally we're having some production of those within the country.
Okay, and just before I move on to others, in terms of you walk around and you find people who believe the important thing is to have a mask, not necessarily to wear it. So it will
Yes.
be under the chin,
Correct.
it will be tied around your neck.
Yes.
Your comments?
Well, can I use my mask to actually
Please.
demonstrate?
Please. Because
I did come with my mask, which I was wearing as we went into the public spaces. So we are finding a lot of this, okay?
Right.
And this is not how the mask should be used, because imagine if you emit particles into the air and my mask is here, okay? The particles get into my body through my nose and mouth, not through my chin.
Right.
Right? So ideally...
So for that is just people who say they're legally compliant. So you don't only wear a mask.
And yes, this is unfortunate because it means they don't have understanding. They've not understood the role of the mask. The point is we need to help our people understand the role of the mask. Now, remember, we said stay at home first as much as possible, okay? If I stayed at home, I don't need to have this. So that is the first layer of protection way before we come to the mask. So this we are using when we're out in a public space because we have to be. At some point you must go and buy food, for example. So you go into a public space. That is when you need to have your mask.
To protect you and the other person as well.
To protect you and the other person.
Right.
So the mask should cover your nose and mouth and go around, okay, like that. So we hope people understand that it's not just because we don't want to get arrested. If this virus gets out into the community on a large scale, we are going to have major problems.
Okay, Dr. Nturbi, we'll continue with this conversation in a moment. But first of all, Sheikh Abdul Latif, if you can hear me, you've just joined us. Good morning and welcome to Your World. I can't quite hear you, Sheikh. Good morning, can you hear me?
Yeah, morning, how are you doing?
Very well.
I can hear you, loud and...
Okay, thank you so much and shukran for joining us this morning. Now, Sheikh, first of all, how has your world changed as a result of COVID-19?
It has changed tremendously in so many aspects. We as religious leaders, we are in contact, direct contact with the community constantly, all the time. We pray 5 daily prayers at the mosque in a congregation. As a counselor, I meet people from morning to evening. As a social person, people come all the way, even at home. They call all the time and so on and so forth. So there are so many angles which it has affected us as community people, as religious leaders.
So how are you conducting prayers?
We are trying to connect through technology. Of course, what we tell people that they should, prayers have not stopped. They've only stopped in congregation in the mosques. But people, they should still pray at their homes and their places where they are. Because you need that spiritual development, strength to keep you going.
And I know you working at the Family Resource Center at Jamia Mosque, as you say, you're also a counselor. How are you supporting people who need counseling?
There are people who we connect through technology, and certain cases sometimes you need to see them in person, especially when the issue, family issue, has become big and quite serious.
Okay, Sheikh, just stay with us. Good morning, Pastor Moredi, if you can hear me. Welcome to Your World. He's not joined us yet on the line, but I've got John Wills Njoroge. I know that you do quite a bit of mentorship. First of all, very briefly, how has your own personal world changed as a result of COVID-19?
Hey, thank you. As an extrovert, I think we need a support group because staying at home, it's not as easy. But also, it has created time to connect with the family. That's a positive side. On the other hand, trying to cope and also adjust because so used to engaging young people and being out there. So I think in one way or the other, I would say there's the positive side and also the negative side.
Now, John, you interact a lot with young people. You're a mentor yourself. You've been for quite a while. How well is the message of keeping, maintaining good hygiene, how well is it being observed amongst the young population?
I think they're doing well, but there's also a challenge of compliance, which is driven by economic issues. Like now, people are affording some of the things like masks and all that. But having said that, I think young people are really trying, because the other day we saw a group of young people in Madare assisting families and others in our streets, feeding street children. And as it stands, I think most of the things that happen globally that would actually change communities, they're started by young people. And so they're doing a great job, not only assisting people, but trying as much as they can to comply and share what they have.
Indeed, we've seen quite a lot of good efforts by many young people around the country. Unfortunately, we also have a few who are just partying.
Yes. That we have seen. And it is a big challenge. It is a big challenge. But I always say that the expression that we see in among the young people, it is a result of what has been passed on to them in one way or the other. So the big question for me is, can we go back and ask ourselves how do we equip young people, and how has our education system been in a way of preparing them to take some of these issues seriously. And I think also there was misinformation about COVID, how it is treated, others saying ni homa tu, or something like that. So I think passing on information, that would really help. Yeah.
Okay, I'll come on to that in a moment. And a group of people was arrested at a house party, and this is just one of the many examples of people being arrested partying. Okay, so maybe a very quick comment from you, first of all, Dr. Nturubi, here in our studio. There was that notion that young people may not necessarily, be infected by COVID-19. What, as a medical doctor, what's your response to that?
Okay. Well, the notion was that young people will not get seriously sick. This is a virus that is extremely infective. It's very efficient at moving from one person to another. So young people will get infected. Now, though they might not get as sick as the older people, we need to understand that our healthcare is across the society. So imagine you have a group of 100 people. 60 of them are young, 20 of them are not so young, and 20 of them are much older. If the 60 young ones, if 30 of them are sick, the likelihood of that infection getting to the other 40 is much higher than if these young people are not sick. Then remember that in our country and many others in Africa, our problem will not only be COVID-19. If many of us are sick with COVID-19, the same resources that are used to treat malaria, HIV, diarrhea, pneumonia will have to be diverted.
So it's a strain on the health system.
It's a strain, and unfortunately, people are likely to suffer more even from the other diseases that we've had for a longer time.
Okay, Dr. Now, this video was posted online by Major, and what he claims to be something that he witnessed. We'll come to the video in a moment, but let me, Sheikh, if you can still hear me.
Yeah.
Now tell me about how you're dealing with your young followers, young Muslim followers. What's your message to them? How are you interacting with them? How are you supporting them in this fight against COVID-19?
There's a lot of sensitization going on. A good example will be what we just saw, that people are told not to intervene.
Hello? Yeah.
I think it's very important for the people to understand why they are told to do so or not to do so, rather than just giving instructions. If you inform the people that it is for their own benefit and for the benefit of their themselves as well as for their families, that they can pick this virus outside and bring it to their own families. Another good example will be the quarantine. People are taking quarantine to be very negative, but I think it's very, very important to be informed and educated for the benefits of quarantine, that is for their own good and as well as the good for the family and the entire population. But since people are not oriented, then they take it in a very negative way. It's as if they're imprisoned.
So are you...
I think information is very, very important. That's why we're doing a lot of sensitization through technology.
Oh, yes, I was going to ask whether you're having to build in some of these anti-COVID-19 messages into your preachings, for example.
Yeah. We've released quite a number of clips and enriched them with the scriptures. And a number of mosques which are digital, they keep on their sermons through technology.
Okay, and John, from your interactions with young people over the years, what is the best approach, do you think, of getting them to work alongside the rest of the society, the few who are still struggling in terms of adopting maybe safe practices?
Okay, thank you. One of the things I have realized with young people is that, as I have said severally, this is the most informed generation. And when instructions are given, unless you answer their why you're giving instructions, they try to push back in one way or the other. And I think one of the things I must commend some of the people who are passing on information is they're trying as much as they can to answer why. And so in the way we structure our messages, I would say that we have tried as much as we can to answer the why people need to do certain things as a response to COVID. And so I would say that there's great effort, and one of the things that we have done is creating messages on why stay at home. And one of the interesting things a young person asked us was, and how are you going to make sure that we get food to eat? So I think they are more interested in having conversations about how to overcome this thing, and also being part of it. And the other thing is that we should not forget that some of the behaviors that we see among the young people, good behavior and bad behavior, is as a result of the values that we have expressed as a society. And so if we can try and build conversations around the values, and also engaging them to hear what the young people have to offer, in this whole process as part of the solution. Yeah.
Okay, thank you so much, Joe. Now, in the streets of Moya town in Embu County, Sarah Wanjiku, who is deaf and communicates through sign language, has heard the call to help. Wanjiku is using her skills to make face masks for the poor and vulnerable people in order to protect themselves from being infected with the novel coronavirus. Rose Wangoi has more.
At a glance, Sarah Wanjiku is an everyday person going about her business. A closer look at her interaction with others, one quickly figures out more about her. Sarah has had a hearing impairment since birth. It is through a translator that we get to learn more about Sarah, who works as a tailor in the streets of Moya, Kirinyaga County. Despite her situation, she has decided to use her skills and make face masks. She is busy making masks to help protect thousands from coronavirus. She usually uses scraps of cloth and makes unique pieces of face masks for a good cause.
You can see that I'm a very happy deaf woman today because you're supporting the people living with disability. I don't sina pesa mingi ya kununua. When I make the masks and then the material is over, I get a profit and then I go and buy another material.
These masks are not only assisting in protection of people from coronavirus, but also serve as a means of livelihood for Sarah.
If I get supported more and more and make more masks for the community, it will be okay.
And her greatest satisfaction is a job well done and customers appreciate her services. Rozongoi, NTV.
Okay, now, Daktari, someone who's trying to do their bit to support community and society, what would you say, though, about those type of masks?
Well, it's the cloth masks that even the US government has recommended their populations to make from home. So we appreciate people like Wanjiku who are making an effort. It is better than nothing. And some series have actually suggested that this could reduce up to 10% of particulate matter.
So what's the difference, cloth and, I know you need several layers of that masks.
Well, the main difference is that cloth is woven, okay? So a woven material has more gaps between the threads, and whereas surgical masks are made of non-woven material.
But certainly for people who cannot afford, these expensive masks, this is a good option.
This is a good option, and we are saying it is better than nothing, right? So in line with what our government has said, yes, you can make your clothes mask and you can use them, and they are reusable. You can actually wash them.
Now, some people think that the masks, you wash your hands, we're good to go. Is that all that's needed?
No, I would recommend that they wash them. So it would be good to have maybe 2 masks, right? So that when you finish with the one you're using today, you wash it and you hang it out to dry. And then remember, through every procedure, you must observe proper hand hygiene.
And for people who are selling masks on the streets and people have to try them on, is that?
No, that's not a good idea. Because again, imagine I have tried on the mask and then I leave it for you to come and try on. That's one of the best ways to transmit my substance from me to you.
But when I buy clothes from the market, Mtush, I have to try it on. Otherwise, how will I know that it will fit my small or big ears?
Yes. And now our world has changed because of COVID-19. So I would not recommend that people get into the habit of trying it on.
Even for people who sell them at supermarkets, what's your advice in terms of making sure that it's not contaminated in the first place, even before it gets to the, in the process of transport to the customer?
It's basically handling, okay? And it's basically handling, and I would advise that customer, once you buy the cloth mask, go and wash it before you use it, okay? Buy it, take it home, wash it, then use it.
Okay. Now, Sheikh, I want to come back to you with a little question. You have a lot of people, you're a counselor yourself. Have you had are people increasingly turning to you? You've got people who are stuck at home, keeping safe, but there are also tensions in families, people who are feeling anxious and worried. Are you receiving more people who are turning to you for guidance, for counseling, because of the situation that they are in at home?
Yes, as widely also put by the Secretary General of World Health Organization, that gender-based violence has really risen. Maybe because of the anxiety, maybe because people don't know what is going to be tomorrow. There are people who are used to going outside, fetch for the day. There are people who are hand to mouth, and there are so many factors which affect. So the matatu industry, for example, the conductor and the driver, they depend on the daily bread. The barbers, the mama mboga, and so on and so forth. All this line, it has been affected in one way or another. So people have less money in their pockets, fulfill the demands of the family. All these factors put together, of course, they affect in one way or another.
Okay, thank you very much indeed. Let me come back to you, Daktari. Yes. Again, I asked you about the different, what these masks are made of, the difference between a cloth mask and all these other ones that people are making up. I was wondering whether we could look at yours and see what is it made of, if you can take us through that process. I've got a pair of scissors here, and I'm going to destroy your mask, unfortunately, but we will replace it immediately because we want you to keep safe.
No, that's fine. I actually brought you one that I've already split.
Oh, really? Let's take us through that.
Yeah, so this is the same mask as the one I'm using.
Okay.
I'd already split this for the sake of demonstrating. Now, this is called a 3-ply mask, meaning it has 3 layers, okay? And when you cut it open, you see that we have 3 layers. Now, one of the main differences between a surgical mask that is made properly and some that are being made not so properly is this inner layer. So when you look at this layer, you see that the material is fairly dense. It's quite dense and quite thick, and it's not a woven material. The mask is generally made of the 3 layers, with the darker blue being the outer layer. This layer is waterproof, so there's a certain test you can do where you put a drop of water on it, and you see that the drop of water stays intact. It doesn't dissolve through. Whereas the inner white layer is meant to be absorbent, so that when you're breathing, when you have saliva on your lips, this absorbs and keeps you comfortable. It doesn't allow you to stay wet on the inside of the mask. And then the middle layer is the middle layer is the main layer in terms of preventing.
Just turn it to me. I want to see the layer. Yeah.
You want to see the layers like that? So the middle layer is the main one in terms of preventing transmission of stuff through the mask.
Now, there was a bit of miscommunication in the beginning as to which side should face outward. Is it the blue? Is it the white?
It is the blue side, which is the water retardant side. It does not absorb water. Whereas the white water absorbing side is for your face, to keep you comfortable, because it is absorbent.
Now, and for those who are saying that wear this type of color to show that you're sick, I'm sure you came across that kind of notion.
Yes. Well, no. So we want, ideally, remember, if you're sick, where should you be?
At home, possibly in hospital, yes.
Or in hospital,
yeah.
Right? So in this COVID era, we are saying, even if you have a flu, okay, for the comfort and our safety of everyone else, stay at home. Even if it's not COVID, stay at home until it has passed.
Now, when you wear this mask, it's very difficult to communicate with people who are wearing, and people are struggling with that.
Yes.
I've seen people have to take it down to laugh or to talk.
Yes. Or to do press conferences. So, again, the recommendation, remember the first levels of protection: elimination, substitution, engineering controls, administrative controls. So, for example, by the time you're coming to do a press conference, all those should have been put in place so that even with social distancing, you don't need then to be doing a press conference in a mask. Because, yes, it is very difficult to talk or to be heard when you're wearing this.
We've seen in those press conferences them exchanging microphones between speakers. Is that necessary?
That's not a good idea either. Okay. So, again, as part of the safety measures, we want to have adequate microphones so that people are not interchanging. Because remember, I'm talking, I'm holding this thing. As I talk, typically some spittle, some saliva will come onto the hand. Then I pass it to you, right? So administrative control would mean that I have a microphone here, you have a microphone there. Or maybe it is fixed, I come and talk, I finish, I go.
So there's
you come
no
and talk,
physical
there's no physical interaction. Then that microphone will need to be sanitized once we are all done.
Then you've got people, for example, who are asthmatic and may struggle to breathe properly through this. What are your thoughts?
Well, yes, that is actually a very valid issue. Asthmatics generally could struggle to breathe even without a mask. What needs to happen is that their asthma needs to be well managed. When the asthma is well managed, whether they wear a mask or not, should not be a problem. Sometimes, another issue that might come up, some masks release some fine lint, okay, some particles, material or cloth particles, and those could irritate an asthmatic person and trigger an attack.
Now, the mask in your hand, is this a single use?
This is a single use.
What does that mean?
This means that when I'm done with my procedure, remember the mask is to be used for a procedure. So this time maybe my procedure is I'm going shopping. So I'm going out to a public place, okay? When I go out and I finish my shopping, a disposable mask is supposed to be disposed after the procedure. Now, let me also add, there have been some advices given by health authorities because of the circumstances we find ourselves in, that sometimes you can recycle, you can reuse this mask, especially if your procedure was short, the mask has not gotten soiled. Okay, soiled means that the inside is wet because of my sweat and saliva, or that the outside has actually gotten dirty because of handling. So if the mask is not soiled, you can reuse it, but remove it carefully, store it aside, and before you go into any other things you're doing, remember hand hygiene, washing or sanitizing.
I struggle with the storage. When you take it off temporarily, where do you put it in a plastic bag? Do you put
that's a bit of a challenge, I can imagine. So probably what would make sense is to have a bag, a small bag you carry that you can put your mask in to keep it again from getting into contact with many other surfaces.
Okay, and now talking of masks, surgical masks being an added expense for enough people, Murang'a residents have decided to come up with alternatives. How safe is this? Daktari, I don't know what to say. Do you have thoughts on, first of all, is that a mask?
That is not a mask, and this is really sad. We all have a role to play to educate our people, okay? We should not take understanding as a privilege, right, or as a right. It's not everyone has the understanding. Let's help our people understand that this is supposed to be a barrier, and ideally you want it to cover an adequate space, okay? That is people trying to find a solution who already have a challenge.
What's the problem with that kind of?
First of all, the question is, well, that is underwear. So where did it come from? Could it be also contaminated, right? As you can see, it is obviously not adequate. It is literally just covering a small part of the face. So I really would wish for their leaders to come out and intervene so that people are able to do the right thing.
But if that's all that people have, they may not be able to afford the kind of masks that you are displaying here.
So I think I would start by helping them understand, for us to prevent infection, let's start with the first measures. Again, I come back there. So for example, those people in the market, those ladies are in the market, they are out there to earn their daily bread. What can they do in their market to ensure social distancing? Even before we come to the mask. Finally, even sharing a video or a clip like what was shared by the CDC on how you can take an old t-shirt and make a mask. That would be a much better solution than what they've tried so far.
So you could look for any other sort of piece of cloth
Correct.
at home that's
yes.
probably clean.
Yes, and fashion a mask. There are actually guidelines that have been issued on how to actually cut them, do the measurements and make yourself a mask.
Okay, thank you. Thank you very much indeed, Dr. Nturubi, for joining us this morning.
My pleasure.
We've all, I think, learned a lot more about masks than we probably knew before. Thank you so much. We hope we can call on you again in the course of the week. And now, they call him Corona, John Corona. This is not a newborn baby, but a grown man from Kinangop, Nyandarua County, who feels the pandemic has given him a bad name For residents of Kinangop in Nyandarua, Corona has lived among them since the 1980s, entertaining them with his music. Sharon Baranga reports.
60-year-old John Wanyoike, popularly known as Corona, is a resident of Njabini Township, Kinangop in Nyandarua County. He is an artist, and in 1980, he coined a name that will be his trademark, Corona. Corona, as he is known to many people, coined the name together with his brother when they started the Kinangop Corona Boys Band and released their first album in 1982.
Jina la usanii naitwa John Corona. Watu wote hata watoto wangu wote watu wanawaita Corona.
Corona says they settled on the name simply because when they arrived in Kinangop, it was dark and their music brought some light. Corona is an English word used in astronomy to mean the glow surrounding the sun or moon or other stars, and is only visible during a total eclipse. For Wanyoike, the name was fitting given the dark hour he and his brother arrived in Kinangop. Their arrival was meant to liven the mood of Kinangop residents. At first, he spelled his name Corona with a C, but later changed the spelling to start with a K.
Nilibadilisha C kwa hiyo signboard yangu nikaweka K. Juu watoto wengi walikuwa wanasoma Shorona. Nikaona hawa watoto wanashindwa kusoma, nikasema wacha niweke K. Juu wasome vizuri Koro. Lakini jina ni Corona ile ya C tangu zamani from 1980.
Nimemjua kwa miaka mingi, lakini nilikuwa najua jina lake, hatujui jina lingine. Tunajua jina lake ni Corona, na alikuwa muibaji na mchoraji wa picha.
Sasa wakati jina Corona ilikuja au hivyo hoja naitwa Corona, nilijiuliza jambo la kwanza, mbona akajiita Corona na mbona kwa kuja na ugonjwa inajiita Corona? Sasa hiyo swali ni swali ambao nimekuwa nikijiuliza, but sijapata jibu yoyote.
And they were not only dealing with music. The Coronas were also the brand owners of Corona Cinemas, where they specialized in running shows in local primary schools around Kinangop.
Nilikuwa nasikia jina Corona tukiwa kwa shule. Tulikuwa tunaletewa sinema zinaitwa Corona. Hata nilikuwa nasidwa huko, hii ni picha inaitwa Corona ama ni mtu.
Amenisaidia kabisa juu amenipatia hata kibada hapa nje ya kwake ili niweze kulisha watoto wangu, na alafu anasaidiaga mkaa mtoto wangu mambo ya kuchora hata saa hizi.
And as the world continues to grapple with the coronavirus pandemic, what started as his trademark name in 1980 has all of a sudden blown up in Njabini. At times, a number of people visit his premises out of curiosity, while others avoid him, associating the name with a bad omen. Currently, Corona lives in Njabini town. He focuses on artistic works, mainly designing signboards and rubber stamps. Sharon Baranga, NTV.
Corona, Shorona, this guy must be considering some copyright issues there. He must be the famous man in the world. Thank you so much, Sharon, for that piece from Nyandarua. Now, let's see what you've been telling us through #NewNormal. We've got a comment here from Owori Silas Hope. Here in Uganda, if you go astray against President's order, you go to jail. So I'm in lockdown and his directives working. We have 28 active cases, in total 55. Thank you, Owori, for that. And we've got Peter Oguso. Stay at home, use face mask while going to the shop, wash my hands whenever I've come from a known place, but bathe once in a week. Hope I'm safe. Okay, thank you, Peter. Another comment here from Abu Bless. There is no one who knows what may happen tomorrow. May it be a church leader, pastor, bishop, politician, prophet, etc. So our hygiene is in the hands of our Creator, who is God. Yes, we asked you to tell us about your hygiene. There's another comment here from Mary Wahome. Always keeping social distance. Wear a mask while in public, washing hands regularly, and sanitizing with lemon. Okay, thank you, Mary. Another one here from Ambassador Fred Kanyanga. Staying at home and keeping social distancing with the people around. That's your approach. Thank you for the feedback. We've got another comment from Karanja David. Washing my hands with soap and water. So clearly the message of soap and water and sanitization is sinking in. Anymore? Yes, we've got Mike Otuoma. I would really wish to stay at home away from coronavirus, but I have no money. So I only wash my hands, put on my mask to go and hustle and keep praying. We hear you, Mike Otuoma. And one more from Davina Manchester, staying indoors, washing hands when eating, using a mask, wherever I get out of the compound together with my sanitizer. So those are your ways of keeping hygiene. Thank you very much indeed. And do keep them coming in, our hashtag new normal. Now, with me in the studio is Dr. Ouko, who is a sociologist, a lecturer at the University of Nairobi. Now, this is your territory, this whole business of social distances. So let's unpack it. But first of all, personally, how has your world changed?
Oh, well, I'm staying at home, so I guess that's how my world has changed. Because sometimes you look at your house during the day and you're thinking, oh, this is how it actually looks like. Because most of the times by 6, you're out of the house, you're back at night, So there's a bit of restrictive, control, which is not of your own making. So sometimes you feel suffocated. But personally, as we say, it's quite refreshing, actually.
Now, the biggest casualty of, social casualty of COVID-19 is our, physical interaction.
Yes.
We greet one another, we hug, that has suffered quite a bit. Your thoughts?
Yeah, this whole COVID thing has really disrupted social life. And, as a sociologist, sometimes you sit back and you wonder, what is normal? Because now we are redefining normal, and everybody is trying to cope with what you're calling the new normal. And when you think about it, human life is made of routine and habit. And those routines and habits are what make your personality who you are. And so therefore, when all these things are disrupted and you have to adjust, then the first thing you do is reevaluate yourself. Before you reevaluate your wife, your husband, your child, first you think, okay, so what else have I been doing which now I'm not doing? And once you do that, then you come from a position of, self-apprehension. And that is where the change starts. Because then somebody calls you and says, hey, let's have a cup of tea. And you're like, oh, I'm coming. Then you think, I'm not supposed to go there. So everything changes. And you say, okay, I'll talk to you on phone or we'll do whatever it is. But in terms of the community setup, you're thinking of a situation where you're supposed to meet and interact. And sometimes you have fellowship, sometimes you have just friendly gatherings, and they're not possible anymore. So everything is topsy-turvy. Things have turned upside down. But the only beauty is that it has forced us to redefine, our behavior, our habits, our routines, and above all, even our moralities. Because then you're thinking, in the evening, what would I be doing now? I'm sitting at home, So everything has taken a beating, sometimes for the better.
And now, I'm talking about community. As Africans, we're a communal people. We have rituals, we have practices, we have burials, we have things that we observe and we partake together, a certain number of things. That too has had to shift.
Yes, that is the social crisis, that, as we are calling it, that things are taking a beating. When you look at certain cultures, like where I come from in Nyanza, there's quite a bit of ceremony, ceremonial razzmatazz attached to burials and, funerals. And now somebody is telling you, if you lose a loved one, number one, bury him or her quickly. Number two, there's no ceremony here. You're not inviting like 1 million people to come and, run around the homestead and bid farewell to the person. So a lot of people are left, socially bankrupt. People are saying, okay, so I am sick, nobody's coming to see me. I've lost someone, nobody's coming to mourn with me. So what world is this? And that's why everybody is now trying to redefine, their social outlook to life. And the only other strange thing is that people are then realizing that there are actually things you could do without, either as an individual or as a community. There's so many things that we do. And now that this virus just came and hit us, for 6, then you're thinking, okay, then we really don't need to do this. So I guess when we are done, when this thing hopefully gets out of our lives, there are a lot of things we'll have to reevaluate. Even as community, as a community, you think we used to do this and we never did it for the last 5 months. Yeah. So.
But now, just on that again, life after COVID, we don't know how long we're going to be in this.
Yes.
But when we come back, how easy is it going to be for us to readjust to the new normal of then? Or are we going to be are we going to be now the cold people who don't physically...
I was interacting with a colleague in the profession, a fellow sociologist, and he was fearing that there might be an explosion of bad behavior after this. Because, everybody has been so restricted, everybody has been so cocooned, and then you're like, finally, it's all done. Whether it's a vaccine or whether it's just a political declaration or whatever it is they tell you, that everything is now okay. It's this guy was talking about the fact that when you hold out for too long, when you finally get your chance to break out, if you are a drunkard, then you'll be like, okay, let me experience my first blackout, And it's the same thing like what we always used to say about HIV and AIDS, that the day somebody finds a vaccine or a cure, you can imagine what will happen to, sexual morality and that kind of thing. So the coronavirus might be doing its quote-unquote godly will at this time, keeping people down, keeping people hemmed in. But as soon as somebody pronounces it gone, then there might be, that explosion of criminality, of deviance, and all those things.
Okay, Dr. Uko, more to discuss. But first, obey the curfew, stay indoors, and do not go outside the Nairobi metropolis. That has been the government rallying call, repeated day in, day out at each press briefing. It's the government's desperate move to curtail the further spread of the COVID-19 disease in the country. These measures, however, are being blatantly disregarded in parts of the city. Eunice Omolo took a trip to some of these areas, and what she found out was quite frankly scary.
There will be a daily curfew from 7 p.m. to 5 a.m. in the morning, and this shall be in effect in the territory of the Republic of Kenya, with all movement by persons not authorized to do so or not being medical professionals, health workers, critical and essential service providers being prohibited between these hours.
The night gathers and our watch begins. We are on Thika Road, one of the busiest highways connecting the now contained Nairobi to other major towns. Now unusually underutilized due to the active curfew and most recent containment.
It is exactly 6 hours after the onset of the dusk to dawn curfew on 8th of April. As expected, it's quiet, no movement, no cars, but we want to do a check and find out if Nairobians are following the laid down rules and if they're following the orders by the president. No movement from 7 p.m. to 5 a.m. This is considering that Nairobi is one of the high-risk counties that has the highest number of COVID-19 cases reported this far. Let's take a look.
We shift our focus and divert to Pipeline Estate in Nairobi Eastlands area. In the dark ages of the COVID-19 pandemic in the country, defiance of some is prominent, a total disregard of the dusk to dawn curfew. Boda boda riders and their passengers calculating routes, the thickest of the curfews within the estates. Other than defying the movement, no masks. Life here seems to be going on as usual. The only disruption perhaps an oncoming vehicle, but only because they don't know if it is the law enforcement or fellow lawbreakers. Police officers were here about 2 to 3 hours after the onset of the curfew, but as soon as the now mastered patrols were done, it's back to business as usual. Shops operate up until midnight. We understand that a majority of these are selling cut to keep the defaulters of the curfew awake and imbibers of the night alert. Windows wide open, chit-chats and purchase going on. For those with a slight remainder of cautiousness, a cardbox surfaces to keep business running. The other businesses of the dark too go on as they have before the COVID-19 disease. The police have been accused of laxity, this after they were accused of using excessive force to enforce the curfew. While other Kenyans are tucked behind their walls to keep the spread of the virus away, socialization goes on in this estate, the chills of the night braced by the warmth of bonfire defying the social distancing rule.
Wow. That's Nairobi as it's happening in some quarters. We'll take a short break.
Have you shared your bongo points with someone who needs them? Remember to help a friend or anyone in need to buy food using your bongo points. Stay at home, but still stay together. with your loved ones and friends using Bonga Points. Share your story or video of how you've helped a fellow Kenyan to our FB page NTV Kenya, Twitter page at NTV Kenya, Instagram at NTV Kenya, SMS 20686 or our WhatsApp number 0745 925 002.
Extraordinary times call for extraordinary measures, especially for us who major in shaking hands or even taking a high five. We have to find an alternative to doing this. And in fact, the most effective way is doing this. Wash your hands constantly with soap and running water, because we are told the most effective way is to drown the germs as you wash your hands thoroughly.
Let the music hit you, move you, or just make you end your day perfectly. Catch hit after hit of music that gets you grooving on weekday nights. Only on NTV.
Okay, so we saw a short while ago just those scenes in Nairobi and how people are obeying or disobeying the curfew. Now, John, I know you're still with us and you watched that clip. What's your reaction to how people are observing the curfew?
I think, thank you. I think it is sad. It is sad. Because I think one of the things that we realize, unless it's home, sometimes we don't take it seriously. And one of the things I would say is that, as someone said, we may need to have to build conversations and also ask ourselves what is making people behave this way, having been given the direction and also being exposed to because there is a lot of information out there. I know there is misinformation, but we can see what is happening in other states. But in all that, I think we are so used to trying to belong to a community, and that desire and that need that we have as human beings. And so the question is, how else can we meet this need, even as we go through this hard time. Yesterday, my nephew called me, and there are a few people who are fighting in the neighborhood, And it's simply because we are not used to being together, because these are busy environments. And so we are also scared of meeting ourselves within our own homes. And so how do we encourage people to observe this in this new way of life? And I think there's just a reset, because we are going back to how we should be living. And I think we are scared of that, and that's why we have conflicts at home. Yeah.
Okay. Let me pick up something that to you, Dr. Oko, that John has mentioned there, which is we're afraid, and I think you made allusion to that. We're afraid to confront ourselves. We are forced to, confront ourselves, confront our own families, whom we just see in passing. Some people.
Mm-hmm. Yeah, you know, the essence of being together also has its negativities, because then, like everybody is saying, oh, the family unit has benefited, marriage is now, more ventilated. But when you think about it, these are people who never used to sit at home. So now you're there and you suddenly start discovering some sides of your children or your spouse that you never knew. And with that revelation, what we call personality unraveling, there's always, question mark. In fact, one of the biggest problems we're having right now is the issue of fear and trust, because everybody does not. You look at somebody and you don't trust them. You don't know whether they are sick. You don't know whether they're okay. And somebody coughs or, clears their throat next to you, you're already jumping. So there's quite a bit of, tenterhook behavior, that people are so alert to the other. And so when somebody comes and clears their throat next to you, the first thing you're thinking is, are we safe? And that never used to happen to us, because people would hide themselves in matatus and, squeeze each other into buses. And that's not there anymore. And even at home, sometimes you're finding a situation where you go to the gate or you go to your door and somebody's standing there and you're telling them, hey, you're too close, move. And that is something that has never happened to us. This thing of social distance has always been, just one of those things we don't observe. In fact, it is, sociologically speaking, the social distance should be narrower between people, so that when they're closer together, then group solidarity, bonding is enhanced. But that is not happening anymore.
I actually wonder about the terminology. I know some people use physical distancing, because you do need you do need this. You do need a closer social distance. It is a physical.
True. Yeah, it's actually the idea of just keeping away from each other. Socially, if you think about it, the advent of the cell phone is what has saved people's sanity in this, at this time. Because you can imagine if there was no cell phone, this whole technology of, the smartphone sharing and talking on phone and doing stuff through WhatsApp, through, Instagram, I think a lot of people would have gone crazy. Yeah, so the social distance itself has not narrowed per se. You're right. It is just the physicality that you have to keep away from each other. But when you think about it, even that social aspect of congregation is usually very critical. Talk about church, for example. Right now, the priests and the pastors are telling us, church is not the building. It is supposed to be your heart and your mind. But it's not the same. Even the Bible tells you that where 2 or 3 are gathered, then the presence of the Lord is felt.
And even going to church or to a mosque is a social activity.
Already, yes, that it is. On Sunday morning, you had the family together and you head to church. And that is one of those rituals, routines that families use to get together, to bond after church. Then either you go visiting or you go have lunch together, or you come back home and cook. So once all these things are disrupted, the essence of trust, begins to put a big block. It's like the elephant in the room. Because then you call somebody and you say, can we meet? And then they could use that as an excuse and say, we are not supposed to meet. Maybe they're just avoiding you. Yeah?
And that trust also, you see it reflected in what we saw in those night scenes there in Unisomolo's story, where there is a night economy that was already in existence. And you're telling these people now...
Shut up, yes. Yeah. So, when you think about it, think of it politically as well. When you look at countries where the political leadership has a tight rein on the population, you're realizing that they're actually obeying these things. I mean, Uganda is a perfect example. Museveni, the president, has got such a tight control of the country that when he says, let's do it like this, you're not hearing anything from Uganda. Same thing with Rwanda. Everybody was applauding Rwanda, but just because Kagame, as democratic as he is, he has a very tight control on what goes on in Rwanda. There's so much freedom in Kenya that people can wake up and tell the president this, or the minister, or whoever it is. That's the beauty of Kenya, but also it is now our Waterloo. Because there's so much freedom that when the president tells you, no, come on, please stay at home, and you're like, why?
Yes, and that's why. And the social and physical distancing. Now, this video was posted online by a Major, and he claims it to be Burundians partying to his new hit song, Utawezana. Some doubts also surfaced, claiming it was a certain club right here in Kenya What do you guys think? Burundi ama ni Kenya? Dr. Uko, that was some social distance.
Yeah, that's exactly what I'm talking about. That looks like Kenya. But yeah, you know, when you think about it, people will still want to do what they do. You know, there's a certain excitement in disobedience. And when you tell your child, for example, don't watch that YouTube channel, the minute they go back to their room, that's the first thing they do. You know, they check, what's this that daddy's telling me not to watch? So it's the same thing when people go against the norm. You know, then it excites them in a way. And just that idea of maybe getting caught or, you know, being dispersed by force, that is part of the experience that you'll share the next day.
Right.
And you say, oh, we were doing this, and then the cops came, you know. And it's amazing how the human mind works.
How we are structured and constructed.
Yes.
Thank you, Dr. Uko. Now, Pastor Morethi, good morning. If you've just joined us, welcome to Your World.
Good morning.
Yeah, nice to have you on this show. Now, to begin with, you senior pastor at Mavuno Church. How has your own personal world changed as a result of COVID-19?
Oh, wow. Quite a bit. Definitely, like every other Kenyan, disrupted. I worked at home considerably even before this, but now it's not just working at home, it's working at home as a family with the kids there trying to do their work. Trying to do my work, my wife trying to do her work as well. So there's been a lot of adjustment and figuring out the new normal, because I agree with your hashtag, this is the new normal.
And in church, how are you observing things like social distancing for those who physically come to church?
Well, right from the beginning, actually from the time the first case was announced, we decided to go entirely online. We are fortunate as an urban congregation that many of our members had access to the internet, had access to gadgets. We were also able to partner with a local TV station for those who were not able to get online. So we've done a lot of our stuff online in terms of Sunday gatherings, our normal Sunday gatherings. We also have what we call our home groups, our life groups that meet during the week. And even those, we had to get into a very rapid learning curve, get everybody connected so that people are meeting through Zoom and using other technologies like that. And so we really don't have much interaction physically. Most of our staff work from home now. So it's been a huge shift and a big adjustment, I must say.
And as a pastor, there must be a difference between preaching to a packed church where you can physically see your faithful and speaking to them through a mobile phone camera or online.
Yeah, absolutely, there is. And it's a, you know, I feel like what is happening though, we already had a live service going on. We already had a Facebook service. We were streaming our services already. The big shift for us is now everybody is doing it online as opposed to this being just the few. I would say the biggest shift is the loss of that interactivity. You know, when you're preaching and people are there, you can see their responses, you can see their faces. So we've had to try and figure out how to get that live interaction where there are comments and you're reading people's comments and responding to those. So making do with the technology, with what we have.
Now, Pastor Morethi, quite a few people have been discussing the origin, the whys of COVID-19 and saying, perhaps God is angry with us.
Yeah.
Your thoughts?
Here's what I would say. I think that those are big questions, and I wouldn't be sure right now that I'd want to definitively say that. I think, however, that there's some things that we need to consider. We live in a world, the biblical worldview is that God created us and put us in a world that he put us in charge of, and that he gave us responsibility over this world. And so, you know, when we talk about, for instance, I'll give an example. You've got a river that is flowing, and then somebody puts a factory next to the river, and because they don't want to pay for disposal of waste, they start to pump their filth and their industrial filth into that river. The river gets polluted. Then eventually they'll buy vegetables from Wakulima market, and their vegetables will give their wife cancer. Is God angry? You know, I will say, you know what? I think part of what we experience as human beings is consequences of our actions. Another example is you've got Kenyans understanding that they're not supposed to travel, and then some people fill up matatu and they go up country with a coffin, pretending that there's a dead body, and risk putting a whole county, killing their relatives. But just that selfish interest. Is God angry? I don't know if I want to be as clear as saying that the divine has told me he's angry. But I will say this, that as human beings, there are things we do. I mean, another good example, and sorry I don't want to preach on this one, but you've got a politician who gets money to build a hospital and then decides to channel that money and put it into his bank account. And then now his county doesn't have hospital beds and enough capacity to look after the people. Is God angry? I would say we need to introspect and start to look and to say, what are we doing, or what changes must we think about with this? What are the warning bells that are ringing for us as Kenyans that we must, and people across the world, I must say, that we must introspect as a human race and begin to ask ourselves the hard questions. Because ultimately, I believe that God gave us authority over the universe, and that part of the reason this thing is so devastating is because of our lack of preparedness and the inequalities that are in all our societies. So yes. I think that's a much longer answer than you were looking for. But I think that's the way I tend to lean with this, is to say, as human beings, we have responsibility, and we need to take seriously the responsibility God gives us over this world.
Okay, thank you, Pastor Moridi. Hang on for a moment. Let me come to you, Sheikh, with the same question. Is Allah angry?
I take it as a trial and a test. And not everything about COVID-19 is negative. There's also a lot of positive things which has come with it. For example, wives are quite happy since the husbands are always at home now. There's a lot of positivity also in terms of technology. My children now they've really explored technology because they're studying through Zoom and the like. Their tutors are sending them homeworks. They do them and then they send it back. There are also live interactive sessions and so on and so forth. Anyway, on the positive side, there are a lot of positive things as well. Just like there are also negative issues. For example, we are not used to staying at home. We are used to waking up, having our breakfast and go to work, and then come in the evening while you are tired and interact with your family and so on and so forth. But now we have quality time. Some of the families, they were just together, but maybe they are not using quality time with their children. The child will come from school tired, complete their homeworks, and their husband also is tired, so they won't use they won't have lots of quality time with their own children. But COVID has brought a lot of positivity on that aspect.
Now, Sheikh,
but change also comes with its challenges. And so they change the way we have changed our lifestyle also comes with a challenge.
Now, talking about family, Sheikh, I know that life still continues even amidst the pandemic, and I was hearing that you had a recent wedding under COVID circumstances. Can you tell me a little bit about this wedding that you had recently?
Yeah. Last Friday, I conducted my first wedding through Zoom. It was quite interesting. Of course, the lady, the bride, was in Nairobi with the father and uncles and a few family members. And the husband was in Helsinki, in Finland. Through Zoom or technology, I got them married. We conducted the marriage. Of course, even on his side, the witnesses, they were also on technology. It was so interesting that with the use of technology, the positive side of technology, of course, things which could not happen are now happening because of the lockdown. The husband could not make it to come to Kenya, and they'd already arranged everything. So we had to conduct it, which is the positive side of whatever challenges we are going through.
Now, Sheikh, I don't know about Islamic weddings, whether you're allowed to kiss the bride, presumably over Zoom. That might be difficult. But also, how do they sign these marriage certificates? You should witness that.
Yeah, they did sign, and then for the husband side, they're sending it through DHL, and then the original. He will send the copy, and the triplicate remains with me.
Okay, so that's the lighter side or the happier side of the pandemic. But I want to come back to you, Pastor Mureithi. And some of the challenges is that for families who are spending a lot of time together, which they traditionally perhaps didn't, we are seeing, examples of tension in the families, sadly even incidents of domestic violence or abuse. I wonder whether you're picking this up in terms of people turning to you for pastoral, guidance and counseling. What's your experience?
Yes, certainly there is a lot more challenge that couples are facing, families are facing. I think the thing to realize is in seasons of anxiety, in seasons of big change, then there's always anxiety that comes up, which always produces more conflict and misunderstanding. So I think you've talked about it earlier. There's economic crisis. Many families are facing challenges economically right now. Somebody's lost a job, is not getting the income they're used to, trying to make ends meet. And then again, you're home and you're not used to being home at the same time. Maybe you're home the whole day now. You have to face each other. Maybe you've not even built a habit of being in the same space. You have not invested in your marriage. And so a lot of families right now are facing tension. The children are in the space. So obviously there's just going to be a lot of family tension right now. I think one of the things I'm encouraging couples is that this is not the time. I mean, if you've had challenges in your marriage, this is not the time for you to solve everything. You need to be able to understand you're in a place of tension and give your spouse some slack, cut them some slack, because this is not a normal time. And this is not a time for us to be judging one another. In fact, I remember hearing one of my friends who's a psychologist talk about what they call the anxiety box and say, it's a time for you to list all the anxieties. There's a lot of anxiety we're facing. And maybe we just need to become aware of what that is. List it all out. And then be able to put it aside in a box and say, these are some of the things I must deal with on myself. Because it's very easy to say my spouse is the one that is causing me to feel this way, or my children are the ones that are causing me to feel this way. But a lot of the challenges are actually internal things that we must deal with. And so just, yes, there is, to answer your question, there is a lot of challenge families are facing. But I agree with what the Sheikh said. There's also an opportunity to repair, an opportunity to actually be with the children. I'm thinking the children of COVID-19 season will actually have some of the best times. Some of them will have some of the best times because their parents are actually home in the daytime. They've never seen their parents in the daytime. And so this might actually be a very good time for some families if they're willing to lean in and make it work for themselves.
Yeah. Let me bring you in, Dr. Ouko. This, our social space at home, it's quite dynamic at the moment. I know people have been cracking jokes that some families, the man of the house will walk in and say, "Oh, how tall are you now?" Because obviously he walks in through the hours of darkness. True. What is that doing to our interaction? That shared, continuous sharing of that small space, which is not traditional to how we have lived.
Yeah, I know. You know, when you look at the roles of husband and wife, already we have a problem there, because in sociology we define the role of a husband with the triple P's. You're a protector, you're a provider, and everything else about you is mostly out of the house. Even if you look at very traditional societies, the men were the hunters and the gatherers, the women were domesticated, they would sit at home, and the guy would come back, and that return in the evening is the triumphant moment for the family, that the kids are running to meet daddy, and the wife is like, "Oh, you've come home," and this. Now that is missing. I always say this, spousal familiarity is not always a very good thing. People say we need to know each other, we need to discover each other. But, sometimes the truth is not as sweet as it sounds. So you sit down and then you start looking, like there's a lot of jokes on social media about how people are certainly noticing how their wives walk, how their wives look at home, and everything about your wife or your husband that you never used to see. And women, if you look at those jokes, women are also looking at their men and thinking, this is how you look, how did we end up together? And so that familiarity sometimes comes with negativity. And that negativity of personality unraveling can do damage actually to your relationship, because when you're in each other's space, the guy, typical man, will probably be creating a fiefdom for himself within the domestic space and saying, I'm doing my work here, or I'm sitting here, or I'm reading the newspaper. Usually the wife runs that fiefdom as her own. The guy is now there sharing that authority. And then sometimes she wants to clean up, sometimes she wants to rearrange the furniture. The guy is not willing to move. He's a permanent fixture in that place. And so you find wives starting to ask, like, you don't want to go for a walk? What happened? And that just shows you how difficult it is to cope. But when you think about it, what Pastor Moredi was saying earlier, there's also something happening in the spiritual space, that now people are sharing such times. There are two things I look at. When the pastors and the priests are telling you that, now we have people responding and saying this, they don't usually allow that in church. They go, they preach, you listen, you leave. But this is now a different time. You do it online, and people, the congregation can actually respond and say, hey, pastor, you said this and this and this, and then the pastor has a chance to, So it's like we're engaging in interactive spiritualization, which never used to be there before. And that's a beautiful thing about it. And especially at home as well, we are rediscovering ourselves. A friend of mine was telling me that, these days, my wife and the kids always used to pray, most likely before I get home, because the kids have to sleep. So he has to join in. And this is a guy who's never prayed in his life, So he's sitting there learning how to pray, and he's become quite good at it, So sometimes when you think about it, you mentioned God earlier about God's wrath and God being angry. It's not so much him trying to enforce himself. He's actually wafting into our space and saying, guys, I can actually control you. And so everybody is now going back to Allah and to God and saying, hey, I'm sorry, in case I go, think of me.
Okay, thank you very much indeed. Fascinating discussion. We'll continue. But first, with places of worship closed, believers go out of their way to find ways to fellowship. We see faithfuls congregating to pray outside the KICC. Take a look. Pastor Moredi, I want to bring you here. If you saw that short clip, people are turning whatever spaces they're in into places of worship. This must be good for the soul.
I absolutely think so. I think that, we are spiritual beings. And I think if there's one thing this crisis has shown us, is just how limited we are as human beings. I think it's very easy when we're surrounded by the comforts of technology and when things are working, for us to feel like we're the masters of basically our destinies. And I feel like what is happening when we look at even countries in the world that are supposedly the most advanced, that have the most money, that are in control, and then to see that they're also scrambling. I mean, I think we've all seen some of those horrific pictures from some of those countries in the world where you see mass funerals and you wonder, my goodness, we never thought in our lifetime we would see those things. I feel like when that happens, as human beings, we realize that we were created for more. We start to turn inwards and to ask what is there, because we cannot rely on the external. We cannot rely on those things that we thought would give us stability. And I feel like this is a good time for people to dig inwards, to start reconnecting with their maker, to start preparing themselves. Because I think one of the things I always say when we go to funerals is when we normally get in touch with ultimate reality. Most of us, it's only when we go to a funeral of a loved one that we realize how finite we are. Psychologists talk about this as the denial of death. That many of us, we live our whole life in denying that one day there will be an accounting, there will be a death. And so I feel like what COVID is doing for us, it's bringing ultimate reality into our space, into where we live, and forcing us to start realizing and responding to the fact that we are actually finite and we are actually people who have an end. And so we need to look at our maker. We need to start looking at the things that are bigger than us to find meaning and to find hope for this season. So absolutely, I think a lot more people now are turning to God or more open to spiritual conversations. I'm a scientist in my background, and it's very interesting. A lot of my friends who are in that world, even they beginning to now ask questions because you see the limits of science even in times like this. Now, it's not to say that science is, I really believe science is created by God to help us answer some of the questions and some of the problems that we're facing as humanity. But I feel like in times like this, we realize even the tools that God gave us, they're finite. They have a limit without us seeking the ultimate, which is the Maker himself.
Okay, Pastor, thank you very much indeed. And now, you've been speaking to us on #NewNormal. Let's see what you've been saying to us. Turning to some of your comments here. First one here from Wangi Wagema Daniel. I never realized one can do squats with feet in the air. Time to try it. Yes, that I'm sure you woke up to our Tizi Nyumbani, which is our exercise session, which begins every morning, Monday to Friday, 6:30 a.m. to 7 a.m. Thank you for that. Joyce Kimemia, I've been doing this and some press-ups. Sema mikono na miguu kuuma. Yeah, join us again and again and again. Itatulia, believe you me. Asante Joyce. Next one from Fred Ochia. We're told to avoid men. That's mouth, eye, nose. My question, does the mask cover our eyes? Well, Daktari who was here explained that it's just your nose and your mouth that should be covered. Now, Maina Kaihu, what about the smokers who usually share cigar and muguka sellers? I don't have an answer to that, but thank you for your comment, Maina. We've also got another comment here from, this one is from Junior Vic. Maintaining safety precautions, that is hand washing every time, social distancing, no traveling, wearing masks in public, one way to keep safe from the coronavirus. Yeah, thank you very much indeed. And time for a break.
Umeshikwa.
Sasa ruhusa ya kuchukua mapicha hapa mmepewa na nani?
Tunaomba kama tunaweza muona Zian Virgin.
Tofauti ya Koma basi na Kigango. Kigango nini?
There is nothing that, it is just politics.
Lazima nifanye hiyo part ya mwisho nimalize.
Na ushikilia vizuri kama mtu amekula.
Mteja.
Let the music hit you, move you, or just make you end your day perfectly. Catch hit after hit of music that gets you grooving on weekday nights. Only on NTV.
Snakebite injuries are very common in Africa, and despite this, access to antivenom is still very low. I find out why these life-saving medicines are so scarce and expensive, given that a lack of them could cost you an arm or a leg.
Palm oil is the lifeblood of cooking in Nigeria. The country is a leading producer of same, but imports a huge amount of the product every year, spending about $500 million. Let's find out why.
Rayon hand sanitizers and face masks. Protect yourself against COVID-19. We have a series of products to keep you safe during this COVID-19 pandemic. Contact us on 0703 222 000.
Why is food security so important now? And why does it matter for smallholder farmers? Well, smallholder farmers comprise 70% of Kenya's population. They are the backbone and have to be at the center of any intervention that is looking at food security. But we really need to look at the entire food value chain if we're going to make sure that food security is secured for all Kenyans. Join me on Wednesday at the Leadership Forum with NTV as we discuss this important question of food security in a time of COVID-19.
Nation Leadership Forum. Engaging society, impacting the nation.
First time after giving birth in COVID-19, heartwarming images of the moment Yanira Soriano, who gave birth while in a medically induced coma, meets her baby boy for the first time since giving birth in early April. The 36-year-old had a serious form of COVID-19 and was on a ventilator for almost 2 weeks. The entire staff of the hospital lined its hallways to cheer and say farewell to Yanira and her son.
Needed. And as you know, many patients that end up on a ventilator with a COVID pneumonia do not survive. And the fact that this mom not only survived, but was able to get out of her wheelchair and walk into her car and hold her baby gives us all incredible hope for future patients and our existing patients that have COVID. Our baby had to be transferred right after he was born to our Cohen's Children's Hospital in New York City. And so when she was discharged today, the entire hospital came out to applaud her, but also to watch her meet her son for the first time. Because of the critical nature of her pneumonia, she had to go under general anesthesia and be put into a medically induced coma and be put on a ventilator. So she was not awake when her baby was born and did not hear the baby cry or have any opportunity to meet him right after his birth.
Wow, story of triumph there. New Yorkers sing Frank Sinatra's New York, New York, an ode to all of the city's essential workers and a way to let people sing out and release some energy, says the organizer, a member of the Peace of the Heart Choir. Now, firefighter Louis Kimbita plays his trumpet from the top of a fire engine's ladder in the streets of Quito to raise morale and entertain the residents amid the quarantine to prevent the spread of COVID-19 as the country reports over 8,000 confirmed cases of the virus. Hi, firefighters wa Kenya mko wapi? Now dressed in a tutu and ballet shoes, Jean Morel has been dancing on her balcony in Paris since the beginning of France's lockdown in homage to the healthcare workers on the front lines of the fight against the coronavirus. An Israeli health insurance company initiative to screen for COVID-19 cases is turning heads in Tel Aviv as people are tested at a sealed booth in the street. The grey and blue enclosed booth was set up by Maccabi Healthcare Services in the coastal city of Tel Aviv and is aimed at safe, efficient screening for the novel coronavirus infections. Using his pizza oven to make face shields, one American pizza maker has abandoned the debate over which style of pizza is best to turn out PPE for hospital staff and essential workers instead.
The healthcare workers are on the front lines, and they do not have the materials that they need to stay safe. And so that is a little sad, that here we are, a pizza shop, making the necessary gear. We are making 1,300 today. Our goal is to make 5,000 next week, but we will make as many as are required and that we can make. Until there's not a need, we're gonna keep going.
Just to be out there and not be sure of whether or not you have a mask or a face shield, and those are like the essential things that you need to be able to provide that and to help secure people feeling of ease. I feel like that's a great opportunity to be able to be a part of the solution.
You can fine-tune the temperature, and we're pretty much doing the same thing that we did before. You take the slices, you put them in the oven, you check folks out with that internal clock running for how long it's going to take to cook, and you get them out before they burn. Exact same thing, put the acrylic in, get the other things finished that you need to do, get the acrylic out, just a different product. The women that stayed behind like during the war and made stuff for the war. And that's kind of what it feels like. I realize that we're not at war right now, but that's what it feels like. All productions, all unnecessary productions had to stop. But now it's like, what do you do with that? And then just I put those, they're right here.
Now, did you know that on sleep, infants under the age of 1 year, 14 to 17 hours, 0 to 3 months need 12 to 16 hours, 4 to 11 months, good quality sleep for children 1 to 2 years, 11 to 14 hours, and good quality sleep, children 3 to 4 years per day, 10 to 13 hours quality sleep. Adults, 7 to 9 hours of sleep. Exercising regularly makes it easier to fall asleep and contributes to sounder sleep. However, exercising sporadically or right before going to bed will make falling asleep much more difficult. People who don't get enough sleep are more likely to have bigger appetites due to the fact that their leptin levels. Leptin is an appetite regulating hormone fall, promoting appetite increase. Rates of insomnia increase as a function of age, but most often the sleep disturbance is attributable to some other medical condition. Okay, and now as we come to the close of our show, let me come to you, Sheikh Abdul Latif, and we're looking at life even after COVID. The immediate thing is Ramadan is almost with us. How are you preparing, and how are the Muslim faithfuls preparing for Ramadan?
Thank you so much. Ramadan is Muslims fast during the day, and there are quite a number of issues which encompasses social. For example, we fast and then we share the meal. We pray together at night, prolonged prayer, and it's in congregation. So all these things have been disrupted, so to say, as a result of COVID. But then we are also looking into option 2, how we're going to do it. For example, we are not able to eat together. Therefore, we're distributing dry food so that people can cook at their own homes. We can't congregation, then we'll be praying with our families at home. Giving out is highly recommended, sharing. Therefore, we'll use technology, for example, money, telephony, and so on and so forth. I really like the clip which you just show. These people who are making pizzas now, they're making PPEs. This is being creativity, so that you solve the challenges which you are facing. We are kind of doing the same. In fact, we have a meeting to deliberate on the same at 11. How we're going to go about it. Challenges are there, but also solutions are there.
Okay.
So we're looking into different ways of still being spiritual, but according to the laid down regulations. Thank you.
Thank you, Sheikh. And to you, Pastor Moredi, we are at the moment focused on our immediate crisis, which is the COVID-19 pandemic, but there is life after Corona. And I wonder whether yourself as a church body, you have even begun to put some thoughts into what kind of life we'll face. Experts say it's going to be a lot tougher after the pandemic dies down as society readjusts tough economic times.
Yes, I think one of the things that we realize that. And so one of the things that we're doing right now is talking with our members, discussing even how to build resilience in our homes, building resilience in our businesses. One of the things that I'm very keen on personally is food reliance, food security for families. I really feel like as a nation, we can do all the big picture things, but every family must be able to be food sufficient, even if it's having a small kitchen garden. Being able to make sure that at least we can eat food that is secure, that is safe. So those are some of the things we're discussing with our people. We're talking about how do we help spur our businesses so that people are doing well. We're actually feeding people right now. We've got an initiative right now where we're feeding not just members of the community, but members of the church who've gone through difficult times. But what we're saying is there's definitely stages of the response. There's a survival right now, which is what everybody is trying to secure. But we must also be looking at the opportunities. There are going to be actually opportunities that will come out of this. And so I think that we must also be willing to seize the opportunity. This is the new normal. Life may never go back to what we knew it was. And in this new normal, there are opportunities that we must be willing to seize in our families. I'm here today doing an interview at NTV, and yet I'm in my house, that without having an hour of traffic to come to town. Those are some of the advantages that we can start to lean on, to lean into, and actually create a better future going forward. I feel like this is a reset for us as people, but also as a nation. And there's some things that have been there for forever that we always thought we could never get rid of. But this is a great opportunity for us to start thinking, how do we use this reset to move forward in ways we never could have in the past?
Okay, and Dr. Uko, the reset button has been pushed. Now, one of the things that man is obsessed with, and by man I mean the human being, is control. Power is about control. In the domestic situation is about control. And then suddenly, when this button was pressed, we realized just how little control we have. And that has thrown us off even in terms of when we come back to normal, whatever that normal will be.
Yeah.
That loss of
Actually,
control.
the COVID-19 has been an ego buster. You know, like you find people with very big egos, you know, heads of parastatals, heads of CEOs of big blue chip companies, presidents, you know, all of a sudden you realize that science and money is not helping. You know, so you have to, you know, press that reset button and go back to default settings and start thinking, okay, so where do we start? You know, and when you see things like the images NTV has just shown, that's humanity getting out of its shell. You know, somebody decides, I'm a firefighter, but I'm going to do this, you know, just to try and lighten up the people. There are two quick things before we end I'd like to bring up. You know, there's something called the explanation syndrome. That explanation syndrome is being amplified by COVID, that you're at home, and there's a lot of things that you're asking questions about, and your wife has to answer, your husband has to answer. And then now when this thing ends, that explanation syndrome will get, you know, even bigger, because then you're being asked, you're coming home so late and you just used to be here. Where did you used to go? You know, what are you doing in the evening and all these things? And the kids are like, Dad, you always used to be here with us. Where are you now? And so you keep explaining yourself and you realize that everything else is going tinkan. Then the second thing is what you mentioned. No, somebody else mentioned it about sleep. I don't know whether it's you or you know, when you think about it, we have a chance to sleep. Yeah, and people get to retire early, and you know, you can wake up and stretch, because we're always on a rat race. When you look at modern society, you get back home, you shower, you sleep. And sometimes it's 11 o'clock, you're still going through TV, watching news and stuff. But right now, a lot of people are actually catching up on sleep. So you find that the way sleep regulates behavior, yeah, you were mentioning about appetites and all those things. But there are other problems that we are now solving. You know, there are people who have a problem called nyctophobia. That's the fear of darkness, the fear of going to sleep. And then the worst one is somniphobia, where you go to sleep thinking you might not wake up. And a lot of people then are wondering, okay, so I sleep very little and I'm used to 3 hours, and he gets out, runs, comes back, and all these things have changed. So human health, in a way, has improved, even though the mental health has taken a beating. But, you know, sleep has kind of gained prominence again, and things are improving.
Thank you. Yeah. And now, Sheikh, as we close our program, your final thoughts as well. I'll come to you, Pastor Murithi. What are your final thoughts, especially to your faithful and people preparing for the Holy Month? What would you like to say to those who are watching, our Muslim viewers, and also those who come to your own mosque as well?
Thank you so much. Be healthy by the spiritual aspect of it. Pray. The intellect part of your body. Read at least watch documentaries which are beneficial. Eat well, keep fit, do your exercises. If you're living upstairs, take the stairs instead of the lift. Adhere to the regulations. Clean your hands, put on your mask, don't go out unless it is necessary. And last, I would like to appreciate our health workers, the doctors, nurses, and everybody in the health worker. We really appreciate the people who are on the front line. We really appreciate, we pray for them, we are with them. Thank you so much.
Shukran, Sheikh Abdul Latif. Now to you, Pastor Murithi, your final thoughts?
I think my thoughts would be to encourage us as Christians, but also as a nation, as people, that this reset could actually work for our good. I remember reading recently, a friend of mine wrote an article about how, you know, even some of the colonial realities we've lived under, we've always assumed we'd always have corruption. We've always assumed we'll always have cartels. We've always assumed that our families would always be broken. And yet I feel like COVID actually gives us an opportunity to ask, what do we want to be as Kenyans going forward? What do we want to be as individuals going forward? So I think for me, my encouragement is, don't use this time to sleep in and watch Netflix. This is a good time for introspection. This is a good time to grow yourself as a person. This is a great time for you to increase skills that you didn't have, because the post-COVID world will require a different set of skills. And so this is a good time for you to be investing in yourself to make sure that when this is over and we've entered the new normal, that you are actually aligned to the new normal. And so I think for me, it's just to encourage us. I don't think this is the worst thing that will ever happen to us. I feel like there have been pandemics in the past and people came through them. We will come through this one. But I think the greatest thing that God has given us in this season is an opportunity to ask, what do we want to be after this? And to use this time of slowing down to prepare ourselves, to align ourselves to be that thing in the future. So God bless you. We're so excited. Thank you for the opportunity and the privilege to be on the show as well.
Okay, last word to you, Dr. Oko. You're a sociologist.
Yes.
We are in an era of uncertainty. Uncertain about when this will end, what it will mean at a personal, family level. How does society get back to what it should be, or to a new, whatever the new world will be? What are your sort of final thoughts?
Actually, that's the biggest problem that this whole thing has brought, because the uncertainty starts from now and it continues to the time that you're told now you can go back to work, because there are so many questions. That thing I was mentioning earlier about the explanation syndrome. You're being asked and you're asking questions. When does it end? How do we know it has ended? How do I trust the person who works next to me? And that uncertainty is never good for the human soul, because when there are things you're not too sure about, then it means even your planning is battered, because you start thinking, okay, if this ends by June, then I can do this. But then somebody comes and says, no, we're still not safe. Let's go to July. And then that whole thing has been reorganized. And the uncertainty about relationships is for us as sociologists, I think, the most critical, because then there's so many things that we've always done together, and then you realize I could actually not do them together with other people. And that will create an individualistic society where we have man, everyone for himself and God for us all. And once you get to that level, then definitely we are not in a very good place. Uncertainty always has, a lot of negativity around it, because you cannot program yourself. And there's so many questions you're asking, leave alone asking, somebody else. You're asking yourself, right. How is this going to happen? How is it going to work? And you have to readjust and rethink and reevaluate, and it's really critical.
Briefly, are we going to go back to touch, to handshakes again? Or is it?
Those are some of the social habits I was talking about that will take a beating, because you're now realizing that we can survive without it, and that it's a dangerous thing. Because other than COVID, you're now being shown, a lot of people are going on Google and wondering, how does the handshake transmit something? And once you see other things, you're thinking, it's not just COVID, There are so many other disadvantages of, mingling and shaking hands, even though it's always been one of those social marks of, togetherness and solidarity, that even when politicians sign a deal, we have a handshake in Kenya on March 9th.
So we may not see another political handshake.
I hope not.
Hi, Dr. Oko, thank you very much indeed.
You're
and to my other guest, Pastor Muridi Sheikh Abdulatif from Jamia Mosque. Thank you very much indeed for joining us this morning. And we've got, just before I go, a couple of comments I think I have time for, hashtag new normal. And this is what you've been saying to us. Omondi Omundu, going to the office briefly when it's really necessary. Otherwise, I work from home. I have my sanitizer, my constant companion. That's how I keep safe. We've also got another comment here from Penina Ogonya. I'm already bored with the whole corona issues. No jobs, no money either. Bored? Well, I hear you. And yeah, David Rashad Dujis is saying just the normal 5 daily prayers, that it's a prerequisite, is washing recommended parts of the body 3 times, each starting with the hands, mouth and the face. That's in relation to the Muslim prayers and also the Ramadan, which is soon upon us. Vitalis, masking in public, social distancing, high personal hygiene, exercising. But my neighbor, whom we share gates, washrooms, taps, etc., is such a hogwash, really, every time. Did you just say that? One more comment here from, very long name. Shall I just say, making sure I use my mask anytime in public, maintaining hygiene by cleaning my hands after 20 minutes and sanitizing. And hey, remember, we are back tomorrow starting at 6:30 a.m. We like to start on a high note. So join us for the exercise 6:30 till 7 a.m. before we move into your world. We also want to hear your comments. How are you getting on? How is your spiritual life? How are you as a teacher now in the house? How is your husband who's permanently in the house now? How is working from home? Share as well your videos of family, your own personal recordings, hashtag new normal. You can also reach us via our WhatsApp line. You can reach us on phone, via Skype. All are welcome. So thank you indeed for staying with us. We'll be back tomorrow with more. Good morning.